I'm not going to cut Social Security like every other Republican, and I'm not going to cut Medicare or Medicaid. Every other Republican's going to cut. And even if they wouldn't, they don't know what to do because they don't know where the money is. I do.
The Senate Republicans' health care bill does not sync with one of President Trump's major campaign promises.
Not one.
And, Joe, you tweeted yesterday that GOP bills raise deductibles, cut coverage, and slashes Medicaid. Trump promised repeatedly to voters he would do none of the above.
Well, you know, and the thing is, if you've got the courage of your conviction, say, we're going to do this. We don't think there should be a federal guarantee of any of these things. Do it. Well, Donald Trump didn't do that. He went around and, I mean, he can't even now make up his mind where he praises the Republicans. They have the big party in the Rose Garden. Then he calls their bill mean. Then he's like telling the Senate, go ahead. And then he goes out and says, come on, it's a little mean for me. They need to spend more money. Pick a side.
All right,
Don?
joining us now, Pulitzer Prize-winning columnist and associate editor of the Washington Post and MSNBC political analyst Eugene Robinson, and editor-at-large at the Weekly Standard, Bill Kristol.
Well, let's start with you, Bill. You guys...
Well, I'm just...
You guys at the Weekly Standard...
tend to get that way when Bill's on the set.
Hold off. You're saying hold off on voting on this bill. A very radical thing for a conservative publication to do, to say, actually, let's see what the Congressional Budget Office says. And why don't you read the damn bill before voting on it?
Which was such a Republican mantra in 2009, 2010.
Yes, it
and
was.
Not unreasonably, as it turned out, because there were all kinds of problems with Obamacare that might have been averted.
And how could they do this behind closed doors when all they did, starting with Mitch McConnell and every Republican, and we did it too, how can they go behind the scenes and do a bill that nobody even reads, not even their own members?
I mean, there's a reason there's a committee system, and there's something called a committee that has jurisdiction over health care, and they usually have experts testify, and they argue about these questions. Will deductibles go up or not? What is the CBO score? Is it worth making trade-offs of these kinds? I mean, there is a reason you want to go through a process. For one thing, it allows your side to make the case. Yeah. Has anyone made the case for this bill?
No.
No, zero.
It's just like the House bill.
So Donald Trump said the House bill was too mean. Liberals and Democrats have done a good job of saying this will be even worse than the status quo. And they're asking these Republican senators to walk the plank to vote for a bill.
It's sad.
Do you think McConnell will put this on the floor for a vote before July 4th?
No. I think there's zero chance, in my view, that Mitch McConnell let this bill go at 11 a.m., not knowing that at noon 4 Republican senators were going to say, we're not quite there. I mean, McConnell knows.
These
guys are loyal. These guys are what would give McConnell a heads up. So I think he lets it go, and then he gets to go on Tuesday to Trump and to his own caucus and say, you know what? We don't have the votes. I'm not going to put you guys through a horrible series of votes on Democratic amendments where you're going to look mean to every possible, disabled
but he had to do
group.
it.
But he had to do it. So that's... What do I know? But I think he's unlikely. We are unlikely to see a vote on this next week.
Casey Hunt, explain the thinking here. What are you hearing?
Yeah, you know, I'm not sure that I agree with Bill entirely on that. I mean, one of my longtime friends, longtime Capitol Hill reporter Paul Kane, was writing in the Washington Post this morning that this is a put up or shut up moment. That McConnell is essentially saying, you know, he doesn't want to deal with health care for the rest of the summer. Right. He does not want to tie up the entire Senate doing this. It's bad politics. You know that it's bad politics based on how they did or didn't roll this out. I mean, there was no press conference for me to go to yesterday
but Casey,
about how this was going to follow
through.
We
agree, Casey, that he lets it go after next week.
I mean, the bigger point is, Mitch
but that means a vote on the floor, right?
Not
if they don't vote on it.
Or just pull it.
Yeah, but the bigger point, I think, that Bill's making, and it seems like is something that you all both agree on. Mitch McConnell, who's the smartest guy up there, when it comes to things like this, he didn't go, boy, I'm going to put this out because it's going to pass. He's putting it out to put the issue of health care behind us and go to Trump and say, you know what, we did it. We tried, and we just can't pass it.
And yet another thing not done in Washington.
But the thing is, I do think that they really, truly believe that if they don't vote to pass something, they are going to end up being in a lot more trouble because they've spent the last 7, 8 years saying we're going to do this. And if he does put this, you know, I think that they are on track to put this on the floor by the end of the week. That is the signal that we are hearing. And it may be that they do it without 50 votes.
So
that would be a departure from McConnell's usual strategy.
Yeah, so if they put it on the House floor and they have the vote, it's the circle of life. The conservatives can vote against it because it's too liberal, and the moderates can vote against it because it's too harsh, and they can all go back to their district and say, yes, I wanted to repeal Obamacare, but this bill, and then tick it down in the district and say, well, go back and try it again later. But Gene Robinson, the mistake here is that they're putting these bills out that are getting, I think in our latest NBC News Wall Street Journal poll, I think the House bill has an 11, 12, 13% approval rating.
Yeah.
Well, actually, it's up to 16% now. And I've heard from Republicans saying, oh, that vote won't follow you. Now, you know what? I'm sitting here today because I got elected to Congress because a Democrat in my district voted for Bill Clinton's tax increase in 1993 in the House resolution, but didn't vote for it at the end and thought he was going to get away with that. But I spent a year outside of his office saying, these are all the taxes that your congressman allowed to pass with his one vote. I mean, this is going to follow these Republicans for the rest of their lives. And they're stupid if they don't think it is, even if it doesn't pass.
Well, right. I mean, they're kind of stuck with it whether they do or they don't. So I'm not convinced that this bill is doomed. I wish it were doomed. I hope it's doomed because I think it's terrible legislation. But you know, they did promise for the last 7 years, almost 8 years, that they're going to repeal and replace, repeal and replace, repeal and replace. And I think that the members that at least I've had private conversations with are just concerned about being able to go back to voters and being asked, well, you know, you said you were going to do it, and in the end you voted against it. That's a problem for some of them. Yeah, if they pass this thing, I think it is a giant millstone around the neck of the Republican Party. It's very dangerous to own the health care issue, and to do this with it is even more dangerous.
So, Casey, of the 4 senators who came out, Rand Paul, Ted Cruz, Mike Lee, and Ron Johnson, said they are no's right now. The argument was it doesn't go far enough. We promised our voters that we would repeal Obamacare in full, and this is Obamacare light, is what I think what Rand Paul said, and we'll talk to him about that in a moment. But then you also have this camp, the Dean Heller camp, sort of, that says, I can't go along with this rollback of Medicaid expansion. We can debate whether or not that's a good idea. It puts a burden on states, obviously, financially. But there are a lot of people, millions of them in many states across the country, who are now covered by that. So they're saying you can't take that away from me right now. How do you get this bill to fit between those two camps, or the Rand Paul and the Dean Heller, Rob Portman camp?
Well, look, the basics of this are, it's basically Obamacare. They have accepted this idea that people who, you know, can't quite afford insurance but aren't on Medicaid are going to get federal help to buy insurance. That's the system that has set up. That's what has Rand Paul so angry. And I do think that there's a private perception that Rand Paul might be the only hard no of this group of 4, but that he may just be ungettable. And then, as you point out, the challenge on the other side is Dean Heller is a senator from Nevada. He's probably the only seriously vulnerable. Jeff Flake maybe have a problem in Arizona, but it's really about Dean Heller in Nevada. Could potentially lose a seat in 2018. I think if McConnell's going to take this strategy forward and actually hold this vote, they'd like to be able to let Dean Heller go for this very reason. It really would make deep cuts to these to people who are on the Medicaid expansion. The one thing in this bill that makes it a little easier for everybody is it phases this in over a longer period of time than the House bill. So the political ramifications are potentially spread out over a longer period of time. But I mean, look, I think there's still a really long way to go. There was nobody that came out and said yesterday, yes, I am wholeheartedly embracing this. It's no, we're going to go home, we're going to talk to people. I think it's just going to be a question of which way do the winds blow over the weekend. Does the opposition build for this, or does it dissipate a little bit?
This is